Transitions. We have an amazing group of speakers here ready to talk about almost every aspect of what it means to move from pediatric to adult care. But before I introduce our speakers tonight, I thought I would just take a chance to introduce you as well to one another. So if we go to the next slide, I'm so excited to say that tonight we have over 60 attendees from 35 cities across Canada. And that includes youth, parents, family members, as well as healthcare professionals from children's hospitals and pediatric rheumatology centers, as well as adult rheumatology practices across Canada. This is a number that we hope to increase as we continue our virtual education series in 2021. As this tonight is not just a chance to hear from experts, it's also a chance to be connected and supported in your own journey by sharing experiences and starting a conversation with others. Next slide, please. So quickly before I get started, I just wanted to take an opportunity to introduce you to our organization. Cassie and Friends brings together youth, parents, and healthcare teams with the sole purpose of transforming the lives of children and families affected by juvenile arthritis and other rheumatic diseases. And we do that through research, support, education, and connection. We now have 7 active centers led by parents, youth, and their healthcare teams across Canada. And we hope in the next few years to have a presence at every major pediatric rheumatology center and for every family affected across the country. Next slide, please. Our vision is a pain-free future for kids, and I encourage everyone online tonight to learn more about how you can get involved and to lend your skills and passion to making that vision happen. And you can learn more by visiting cassieandfriends.ca. So I'd also like to give a very, very sincere thanks to our series sponsor. We had a series of in-person family day conferences planned before the pandemic began. And thanks to Nicola Wealth, AbbVie, Amgen, Roche, and Sobi, we're able to bring some of the spirit of those amazing family and youth connection events to you tonight in this educational series. So this is actually our 4th of this brand new series to provide education and connection to youth and families in their homes. If you didn't have a chance to catch one of the earlier series or earlier webinars, we so far have done sessions on uveitis, JIA 101, as well as a young adult panel that had young adults with lived experiences with rheumatic disease sharing their journeys with both JIA and lupus. So I just have a couple housekeeping notes before we get going. First of all, I just wanted to let everyone know that their mics are muted and their videos are off, so do not worry about that. If you have any technical difficulties tonight, there is a dial-in number available in the registration email that you would have first received or the reminder email that you received last night. We have a ton to cover today, and we hope you get so much information for yourself and your child. And we also wanted to make sure we have a ton of time left for questions. So at the bottom of your screen, you will see a Q&A button. And at any time tonight during the presentations, you can click that Q&A button to ask your question, which we will be answering live at the end of the session. Lastly, I just wanted to give a reminder that though transition works differently across Canada, this session tonight is highlighting one particular clinic and the experience of one particular patient, but everyone's journey is different. So while we're providing some information tonight, what we really, really encourage everyone is to use this opportunity to think about your own questions about the transition experience and to talk to your own pediatric rheumatology about the resources and the paths available at your center. Lastly, we encourage you to keep the conversation going, and Cassie and Friends is really pleased to have launched an online support network for parents of children and teens with rheumatic disease. And you can access that at cassieandfriends.ca/support network or by using the QR code on the screen. Now, I'm very excited to introduce our first speaker. Well, we have many, many experts who are joining us tonight, and you can see those faces. Morgan Harris is a true expert in the sense that she has actually made the move from pediatric to adult care. Morgan was diagnosed with juvenile idiopathic arthritis at the age of 8, and she currently lives in Toronto. And Morgan will also be joined later during our Q&A session by her mom, Trish, who is here to answer questions as well. So I'm pleased now to welcome Morgan to share her story, along with some tips for parents and teens who might be wondering or worried about what to expect in this next stage of life. Morgan, over to you.
Hi, so my name's Morgan Harris. I'm 18, I'm from Toronto, and currently I'm in my first year of university where I'm majoring in applied human nutrition. So today, as Jennifer mentioned, I'll be speaking about my experience transitioning from pediatric to adult care, what that was like, and especially meeting my doctors for the first time over Zoom, and some tips for transitioning to adult care. So a little bit about my story. I was diagnosed with JIA when I was 8 years old. I experienced a lot of pain, swelling, discomfort in both of my knees and both my ankles. I was a pretty active kid, so having this kind of pain wasn't so great. And I told my parents, we went to the doctor, and a few weeks later, I was diagnosed. I took a variety of medications and got joint injections from around the age of 8 until 13. And medication and injections really helped me. Plus, for the first 3 years, I still had a lot of pain, stiffness in my joints. But then, for the last 2 years that I was on medication, I didn't experience much pain, not much swelling anymore. And when I was 13, my arthritis actually went into remission. So, from the age of 13 to 17, I had barely any symptoms of arthritis. I was very active, didn't have any swelling, no stiffness in the morning, and no medication. So other than maybe the occasional flare-up that I got, but nothing that naproxen couldn't really help me with. Then when I was 17, about a year ago, I had another flare-up in my ankle, and I was actually in denial about this flare-up. I was convinced that I wasn't getting arthritis again and that it was just a running injury. So it took me about 3 months to actually get over my ego and go to the doctor. And finally, I went, some medical imaging was done, and my arthritis was back, and we're still dealing with that flare-up. So that's a little bit about my arthritis story and past. And now on to my transition. So I was especially nervous to switch to adult care because my whole life I had only seen pediatric doctors. I grew up seeing a pediatrician, and conveniently enough, that pediatrician was also a pediatric rheumatologist. So I had her on my team. Plus, I saw a specialist at SickKids. So between these two amazing, very nurturing and caring doctors and team of nurses that I saw, I was just surrounded by people that really, I felt like they cared about me, and I really trusted what they did because I saw that I went into remission and that my body responded well to the medication I took, and I was just really relieved, and I was honestly just so grateful, and I put so much trust into my doctors that the idea of having to find new doctors really freaked me out. In addition, I was pretty angry that I had gotten this second flare up, and I didn't really want to accept that I had to transition to adult care because for years it hadn't really crossed my mind. I'd also made up this idea in my head that is so horrible, but I thought that adult doctors were going to be scary and that no one was going to take as good of care as me as my pediatric doctors. Luckily, I can say I was very wrong and that adult doctors are excellent and they care about your health just as much as pediatric doctors do. So with being in Toronto, I am so grateful because I have plenty of like healthcare facilities around my house, very nearby. And actually just before I turned 18, my specialist at SickKids mentioned this new transition clinic that was opening up at Women's College Hospital, which is also a hospital in Toronto. And what was special about this was it helped pediatric rheumatology patients transition to adult care and make their transition a little bit easier by them always seeing. So in every single appointment, I get to see a physiotherapist, a pediatric rheumatologist, and an adult rheumatologist. And once I kind of age out of that transition program, I will stay with this adult rheumatologist kind of for the rest of my arthritis journey, I guess you could call it. And this has been extremely helpful for me because I was pretty young when I was diagnosed, and I kind of, for the time that I was in remission, I didn't really expect my arthritis to come back. So I didn't really know much about arthritis until about this year, I would say. So I have a lot of questions myself about it. And a lot of the times when they ask me questions, why, did this medication work for you? Did this not? A lot of the time, the pediatric rheumatologist is able to kind of step in and like either remind me or kind of they'll be able to work out the differences of what happens in pediatric rheumatology versus like adult rheumatology, I guess. And it's super helpful because then I feel like I I don't need to know all the answers, of course. And yeah, it's really, really great. And they care about my health, which is the most important part of it all. So one unique thing about turning 18 in the middle of this pandemic was that I actually got to meet my doctors, my new adult doctors, for the first time online. So for those of you who have maybe done a Zoom doctor's appointment or maybe not, I'm going to kind of take you through how it went and my experience of transitioning and only having met my doctors online. So kind of you go into the appointment, you're over Zoom, and the same thing is as if you were in an office. They kind of go through how are you feeling, how are your joints doing, any other joints affecting you. And luckily I'm kind of old enough to be able to determine how my joints are doing, things like that. Second, obviously no physical can be done. They can't really get a look at your joints because we're over Zoom. But thankfully, I only have my ankle that's bothering me right now. So I just kind of plop my laptop on the ground. I kind of show them, I do some pointing, some flexing of my foot, kind of show them a few angles. Plus, I was able to get medical imaging done so they can kind of have an image in their head of what kind of condition my ankle's in. And then finally, just the same as if you were in an office, talk about medication, what's working, what's not, and the future of your treatment plan. So overall, I actually really enjoyed transitioning to adult care online. Obviously, these circumstances weren't what I had in my head, but there was just a lot less anxiety, I think, going into it. I was extremely nervous to meet these new doctors and to meet this new care team. And so by having just the security of being at home, being in a place that I felt secure, just being in a place where I felt comfortable, not having to worry about last minute, where am I going in the hospital? Am I in the right waiting room? Things like that. Those kind of little anxieties about these new doctor's appointments were just taken away by having to just open up my laptop and click on a Zoom call. Plus, the treatment is the exact same. I'm getting amazing treatment online. So I really did love transitioning online because I felt just a little bit more comfortable. And yeah, so finally, I have a couple tips for patients who are transitioning to adult care soon. My first one is to just keep an open mind with it. Of course, I'm sure a lot of you, older people tell you, just keep an open mind, it's going to be okay. And of course, in hindsight, it's easy to say that. And I know it's hard to do it in the moment because I had a really tough time keeping an open mind, but try to remember that the people your pediatric rheumatologist who's referring you only wants the best for you. Plus these new doctors, they want to see you succeed. They want to see you in the best, feeling the best that you can. So, they're doing the best that they can for you. And second of all, to really use the resources that are given to you and also look them up online. So when I was 17, my hospital gave me, I think, a pamphlet and maybe like a link to an online website. And that was really, really helpful for me because I had to prepare myself for this transition. I was not expecting it. I wasn't really excited for it because I was just so nervous. But that was really helpful to kind of have like a little bit of time to prepare myself for, saying goodbye to this care team that in pediatrics, but then getting to meet this new care team in kind of adult medicine. So those are my tips. I hope you guys were able to take something away from that. And thank you very much.
Thank you so much, Morgan. I know that I was like furiously scribbling notes while you were speaking. So I have to say that there were so many helpful tips and things that I really relate to just from working with families and youth, like that sense of not just like moving away from your pediatric care team, because so often it just like becomes a family. And so there's also this process of like being sad or understanding like what that means to move away from people that often you grow to care so much about. And I also just love that idea of like moving one of the variables of new out of the transition process, because it truly is a process. It's not a cliff. And so that idea that, starting in the safety of your home virtually, I think is something that everyone will be really interested to hear and experience for themselves. With that, and to talk about the transition process and not the cliff, I'm really excited to introduce our next speaker, Dr. Lynn Spiegel. Dr. Lynn Spiegel is a pediatric rheumatologist at the Hospital for Sick Children in Toronto and also associate professor at the University of Toronto. She happens to also be a passionate researcher in this very area, youth transitions, and has helped develop many tools and measures to help parents and healthcare know when youth are ready to transition and how to best support them. So with that, I'm very pleased to introduce Dr. Spiegel, and over to you, Lynn.
Thank you so much for that really kind introduction. And also, Morgan, it was such a pleasure to hear you speak as well. I really thank you as well. And it's so nice to know that there's people coming from so many different areas or attending from different areas. And I'm going to be specifically focusing on what we're doing at the Hospital for Sick Children in Toronto. And I'll be specifically focusing on patients with JIA. Next slide. So what I'll be doing in these next few minutes is just talking about the importance of transition planning. And I'll be talking a little bit about some of the things we're doing at SickKids to help our patients transition from pediatric to adult care. Next. So I thought it'd be helpful to just start with what the future holds for our JIA graduates. Well, we know that arthritis persists into adulthood for about 65% of our patients with JIA, and uveitis persists for about 50% of our patients, which means that a significant number of our JIA patients are going to need ongoing care by adult healthcare providers, which makes it really important for us, the healthcare team, to provide teens with the skills that they're going to need to help them transition from pediatric to adult care. Next. So when should transition planning start? What age? Next. So I think it's really important to make the point that transition is a process. It's not one event in time. And activities need to begin early. And most transition experts will say that we should probably start transitioning planning between the ages of 12 to 14. Next, thanks. So what are we doing at SickKids to help teens with transition? Next. Oh, back one slide. So I thought we'd start first just by talking a bit about our clinics. So first of all, they're staffed by rheumatology nurses, physiotherapy and occupational therapists, pediatric rheumatologists and trainees, including medical students, residents, fellows. And we also have support from a social worker, a psychiatrist, a dietitian, and adolescent medicine. Next. So this team is trying to help our patients develop different transition skills, including understanding their health condition, their treatments and side effects. We want them to learn to advocate for themselves. And finally, we really want them to feel comfortable managing their own disease. Next. So at clinic visits, we encourage our patients to have time alone with their healthcare team. And we spend time making sure that they understand their diagnosis, their medications, whether or not they need refills. We want them to know about treatment side effects. We really want them to tell us about any symptoms they're having, and we encourage them to ask us questions and to share their goals with us. Next. The The next thing that we're doing is we're encouraging our patients to sign up for MyChart. So MyChart is actually available both at SickKids and also at Women's College. And this is a secure online patient portal that allows patients to access different parts of their health chart. So they can access their labs and some of their imaging results. They're able to interact with it and update their medications, allergies, and personal information. They can view any upcoming appointments, and they can also see after visit summaries, which are summaries that the team prepares at the end of each visit, where they provide instructions. There's a list of medications. And again, there's a list of any upcoming appointments. And finally, they're able to send secure messages to the team. So MyChart is a really useful tool, first of all, to empower our patients to become more involved in their care, and just to help them advocate for themselves. Next. So for those of you who are at SickKids or at Women's College, if you want to know how to get access to MyChart, you can just take a picture of this slide, and you can either use the scan feature, or I've provided a URL, or you can actually download the app from Google Play or the App Store, and that'll help you just to sign in. So I've talked about some of the things that we're doing in our clinics, but we also reached out to our patients just to ask them what they felt would help them to make the transition process smoother. And so some of the things that they felt we could help them with was providing them with disease-specific knowledge, self-management strategies, and meaningful social support. Next. So we tried to think of innovative ways of doing this. And so we thought about using social media, and we worked with different rheumatology healthcare providers across Canada to develop a transition website. Next. And so, we've been using the internet, which we think is a really valuable resource for health information. It's a powerful mode of communication for youth, and this makes it ideal for providing online health services to teens. And we've really all become especially aware of that during the pandemic, where a lot of our interactions are virtual. Next. So I've mentioned this website that we've developed called Teens Taking Charge, and it's an interactive site which we've designed to teach teens how to better manage their JIA-related symptoms and help them transition to adult care. It's got 3 different components. So the first component provides JIA information, both general information and then more disease-specific subtype information. And we also talk a little bit about some of the complications of JIA, such as uveitis. Next. So the second component deals with self-management, and we provide different tips and strategies to deal with things like pain, to help manage stress, and to help with time management. Next. And finally, the third component offers social support. So we feature videos from teens who are dealing with JIA. There's a storyboard where people can post stories of hope. It's very interactive, and we've received very, very positive feedback from our teens. Next. The other thing that we have done is we have developed a mentorship program called iPeer2Peer. And this is a Skype-based program for youth between the ages of 12 to 18 with JIA. And we've matched them with trained young adult mentors who also have JIA and who are coping well with their arthritis. And so they can meet and they can talk about issues related to JIA, teen issues, and just things like planning for the future. So we've tested it at SickKids, and we are now testing it at different centers across Canada. And we've received very positive feedback from our teens. And so I'm just sharing some of the comments. I enjoyed getting to know someone who understands what I am going through. We had a lot in common. It got me engaged. She knew these little things that could help. Next. We also got very positive feedback from our mentors. And again, I'm going to share some of their comments. I gave them resources to have a plan. It gave me the opportunity to share my experiences. I kind of like sharing of hope, just being there for someone. It kind of helped me with my life. Next. So, I've talked about some of the things that we've done in clinics and using the internet, but really, is there anything that we can do to help us figure out whether our patients are on track to develop the skills that they need to be successful in the adult system? And, how will we know if there's anything we can do to help them get ready? Next. So what we've done is we've just finished developing a questionnaire that we're going to be administering in our clinics called the RACER, which stands for Readiness for Adult Care in Rheumatology. And what this is a questionnaire that basically assesses some of the different skills we're hoping our teens will develop during the transition process, including disease-specific knowledge, planning for adult life, standing up for themselves, advocating for themselves, managing their health condition, and just knowing how to get around the healthcare system. Next. And what this questionnaire will allow us to do is assess any gaps in knowledge and transition skills, and it will help us to identify areas where teens need additional education and support. Next. So as our patients approach graduation, what we will do is we will identify an adult healthcare provider, an adult rheumatologist, and we'll prepare a transition package, which will include a summary of their condition and their treatments. We'll provide any of their relevant labs and notes from other consultants outside of rheumatology. And whenever possible, we'll also provide a CD that has all of their imaging from radiology. Next. So some of the things that we tell our patients that they need to do is, once we've referred them on to adult care, if they don't hear from the adult provider, we need them to let us know. And that way we can follow up. If for any reason they need to reschedule or cancel their appointment, it's really important that they let the adult team know. Before their appointment, they should just make sure they know where it's located and arrange for the appropriate transport. They should decide if they want a support person to be there at the visit with them. And they should also make sure that they have a family doctor, both to help them manage their health outside of their rheumatology issues. And also it's really important that the rheumatologists have a family doctor that they can communicate with. Next. So on their appointment day, we advise our patients to remember to have a number of things. They should make sure to bring their health card. It's really helpful to have a written list of questions just to know about how the practice works and what they can expect. They should have a list of all their medications and allergies. They should make sure that they have their insurance information for their medications. And it's also really helpful to have a telephone or a calendar just to help them track their appointments. Next. So I've talked about how it's important to plan that move from pediatric care to adult care. Next. And what we're trying to do is we're trying to help our patients develop the skills that they're going to need to graduate successfully. Yep, that's it. Thanks.
Thank you so much, Lynn. That was an amazing overview. And I think both the in-clinic resources and supports to families, as well as those internet resources, like I know Teen Talks is something that's come up in the Cassie and Friends, both teen arthritis groups, as well as several of our Teen Talks mentors online have actually been a part of that iPeer-to-peer program. So I just know that in sort of our past few months, we've seen the way that youth and teens can really benefit from accessing those kind of resources and starting to form really their own support network as they begin to move into the transition zone of peers who they can grow with as well. So with that, I'm really excited to introduce our last set of speakers before we go to our live Q&A, and that is the JIA Transition Clinic team from Women's College Hospital. So this team includes pediatric rheumatologist Evelyn Rozenblyum, rheumatologist Natasha Gakhal, as well as the Arthritis Society physiotherapist Danielle McCormack. So together they lead a program in Toronto for young people living with juvenile idiopathic arthritis between the ages of 17 to 25 to help them transition from pediatric to adult care. I'm now going to hand it over to the team at Women's College Hospital to share more about their program.
Hello, everyone. Thank you so much for having me. It's a real pleasure to be here. Thank you, Jennifer, for the introduction. Sorry, let me just double. Oh, no, I think, is my video still working?
You're good, Evelyn.
Yeah, okay, beautiful. Thank you so much. So first, I just wanted to say a big thank you again to Morgan for sharing your story so beautifully and eloquently. It's stories like that and patients like you that really make our work so meaningful. Originally, we had planned to have this session in person, actually, to bring the patients who would be transitioning in the coming months to our hospital, bring a tour of the facility, explain our clinic, and have sort of breakout rooms with the patients and parents, but obviously COVID hit. So in some ways, this is much better. We have a broader reach. We could really talk about transition on a nationwide spectrum. So for that, I really want to thank Cassie and friends and Danielle for connecting us in the first place. So thanks, everyone. And Lynn, thank you for all the work that you do on the pediatric side and for being a big mentor for me. So we, like Lynn, here will focus on JIA and Toronto as well. Next slide, please. So the objectives are of our clinic are to support patients and families and help them understand, first of all, the philosophy of the clinic as compared to other models across the country and models of care that they were used to in pediatrics. Today, we're just going to describe our own clinic process, the roles of our multidisciplinary team, and how to access community resources, as well as strategies for navigating the adult healthcare system. Next slide, please. So national care models for transition. And I know we do have also a few a few participants who are physicians and staff in other centers that I'm going to speak about. So forgive me if I've gotten anything wrong. Please correct me in the chat or in the Q&A. And thank you for being here. So if you could click. Oh, perfect. So initially when Dr. Gakhal and I started discussing how to run our transition clinic, we had a good look across the country to see what models of care were present in just around the country so that we could draw from their experiences to really make what suited our patient population and geography the best. So starting from the West, and most of these clinics actually are combined rheumatology clinics. So they're called yard clinics, young adults with rheumatic disease. Whereas in Toronto, it's really more a subspecialized clinic. So we have our clinics only working with patients with JIA. We have a lupus transition program, a dermatomyositis transition program. So the principles of transition are very similar. However, in our specific clinic, we just focus on JIA. These other models across the country, as far as I know, are mainly yard clinics, so dealing with all rheumatic diseases. So in British Columbia, they have a very, we modeled our clinic after theirs. And so they have a combined pediatric and adult practitioner clinic, not in the pediatric or adult hospital, which is quite unique. Unless it's shifted, they have it at the Mary Pack Arthritis Center. And they essentially follow the patients around the same time that we do during the vulnerable years of 17 to 24. And so we really took from their model to help to inform our clinic. In Alberta and Calgary, they had more of a transfer program. So what would happen is at the patient's first visit in the adult hospital, the pediatric practitioner would come, introduce the patient, make sure that everyone's comfortable, that the adult practitioner knew the story, and then they wouldn't necessarily follow them in the future after this. In Montreal, they had a clinic as well. And in Halifax, they had more of a, the reverse, where the adult practitioner would come to the pediatric center and help to co-manage the children there or meet them at least one time there until they went to the adult center. And if you could click again. Since then, the program, a transition program, has really bloomed across the country. the rheumatologists who are engaged in this work, by and large, are my colleagues. They have a huge passion for this work. And there's even a new nationwide committee through the Canadian Rheumatology Association to make transition the best that it could be across the country. So it's really exciting work. I know Ottawa has a clinic in Ontario. McMaster started a clinic similar to Halifax, but more involved. Sort of the adult practitioner is there for a few visits from when the patient turns 16 until they transfer. And I know London, Ontario is starting a transition program as well. So anyway, it's really exciting progress coming up. Next slide, please. So in terms of the team members, on the left, we have Danielle, McCormack, then it's myself, and then Dr. Gakhal on the right. In terms of the pediatric doctor, which is my role in the clinic, what I like to offer is that an expertise in the pediatric medicine of JIA. So although arthritis is sort of, can be managed fairly similarly, there are certain unique aspects in pediatric care, such as eye inflammation or uveitis, jaw disease, or TMJ arthritis. And so with that, I like to offer expertise in those subject areas. Also, I help to communicate with the previous pediatric provider in order to provide sort of a bridge for the patient and let them know that, don't worry, you're in a new center, you're with a new practitioner, but I know all your previous physicians, and I communicate well with them. And if there's any need to clarify anything, I can always access them. The adult rheumatologist, like I mentioned, Dr. Gakhal, is fabulous. You'll hear from her in a few minutes. And so she really has her expertise in managing an adult patient and going through the motions of being an adult, and also an incredible knowledge in managing arthritis. Danielle will speak for herself in a few minutes as well, but she provides an excellent service to help assess the patients and manage their physiotherapy needs. And then we have other allied health as well. Next slide, please. And so in terms of the philosophy of the clinic, really we're aiming to provide holistic coordinated care that's team-based. We want to ensure a seamless delivery of care to minimize gaps in treatment and lessen the potential for flare. So it's really important to attend your transition clinics, because like Morgan, who flared a little bit later in her course, that could have happened after she transitioned. So it's really important to get to know your adult healthcare team so that there's no gaps in treatment for you. We like to offer personalized care according to the maturity of the patient and their developmental stage, empowering young patients for self-management. And on the same token, assisting the patient's family members in their transition from the quarterbacks to coaches of their child's care. In addition, promoting not only their arthritis adjustments, but their social adjustments with their relationships, their education, or vocation. So next slide. Some differences between pediatric and adult care. So often it's a busier clinic. We try to staff our clinic to be less busy so that we can spend a bit more time, but it's not every adult clinic has that possibility. Most joint injections will be performed in clinic itself. As you get older, that's a bit more common, but when you're younger, if you had joint injections, often they would be sedated or at a different time. So here we provide that service all in one. Diagnostic imaging of joints may be a little bit different. There's a lot more focus in pediatric and adult world, just with point of care ultrasound or other modalities. The shared care model may not be, you may not see all members of our team when you come to our specific clinic, and our primary clinic contact is My Health Record. So in our clinic, unfortunately, we don't have a nurse, whereas in other clinics across the country, they do. And so, our point of contact is through My Health Record, which we check often and can respond very quickly. Next slide, please. As Morgan mentioned, because of COVID-19, we have a lot more virtual care, and I think she spoke about it beautifully from the patient perspective. From a physician perspective, of course, with arthritis, we like to examine our patients as much as we can, but at least with technology and video, we can at least see the joints that are bothersome and figure out a strategy moving forward. And if necessary and safely, we bring you into clinic to take care of you. Next slide, please. So our patients, such as Morgan, are young adults aged between 17 and 24 who have been transitioned predominantly from SickKids, but also the surrounding hospitals. And when available, we'll use the tools to assess readiness for transition when they come out. Next slide, please. And I'll give it over to Danielle.
Oh, hi. Can you hear me now? Okay. So my name is Danielle McCormack. I work with this amazing team. I'm an ACPAC physiotherapist, which means I have advanced knowledge in arthritis care. I have to say that I'm very privileged to be part of this team. Ever since I graduated from this advanced program in arthritis, I've had a special interest in transitioning, because I've been working in arthritis for a long time, and I've seen people for some reason that did not do as well as possible when they became adults, as they got lost a bit in the system. And I always had this gap in my mind that I wanted to be part of to try to help people transition better. So as a member of this team, I get to assess patients like the doctors do, communicate with their parents the same, and hopefully contribute to the treatment plan. With my knowledge as a physiotherapist and allied health professional, I can also make recommendation regarding some splints or some assisted devices or some specific exercise to the problem joint. So I'll leave it at that, short and sweet, and now we'll have Dr. Gakhal talk.
Hi, everyone. I'm Dr. Gakhal. I am the adult rheumatologist at the Transition Clinic at Women's College Hospital. I'm going to continue and finish this section of the talk. Dr. Rozenblyum had started off about the different components of the transition clinic. And one of the other really important team members of the clinic is the administrative assistant. This is typically going to be the person that you're going to know on a first name basis, and they're going to be probably the first person you talk to, either via a patient portal or on the phone. And they're the ones that are booking all your appointments, booking your diagnostic tests, like if you need ultrasounds or MRIs. They're the ones also taking your calls about medical problems. If you're flaring or you need a new prescription renewal, these are the people that are going to be the first line people that you're going to be speaking to. So it's very important you get to know them. Next slide. We also are lucky enough to have a social worker as well that we can access through our clinic. And a social worker can really focus on multiple areas of your life. So they can help you learn how to make better decisions. They can provide counseling around mental health and wellness. They can help you around relationships, either around family relationships, work relationships, school relationships. They can help navigate issues around funding or finance, education and employment, stress management, how to reach out to resources in your community. If you don't actually live that close to the hospital, they can help you figure out how to get resources closer to home. Next slide. We are also lucky enough to have access to mental health services. So we have access to psychiatry if we feel our patients need it. We have access to all sorts of imaging tests, so we can get ultrasounds, sometimes same-day ultrasound if you're in clinic with us, x-rays, MRIs. We can also help facilitate transition to other healthcare providers. So When you leave the pediatric side, sometimes people need an eye doctor. Sometimes people need a family doctor because they're going to lose their pediatrician. And so we can help facilitate getting those doctors as well. Next slide. Lots of people have already spoken about strategies about how to navigate the healthcare system. So one of the things I've kind of learned over the last few years about seeing young adults transition to adult cares is that it is busier, like Dr. Rozenblyum said, like it's busier and you don't spend as much time one-on-one with the patient, and you are responsible for a lot of your own health care. And so it's really important. What we try to do in our clinic is really to help identify what your health concerns are, what are the school or work concerns that you have. And if you need access to other team members or specialists, we can help facilitate that. And like Dr. Spiegel said, we want you guys to be educated about your condition. We want you to know your disease, know what it's about. We want you to be able to manage a flare. So we want you to have a strategy in place of what you're going to do if, you know, in the middle of the night you wake up with pain and swelling. We want you to be educated about your medications, about how to take them properly, what the doses are, and how to monitor for any side effects. Next slide. And so really from the patient point of view, what do we see as your goals? We want you to show up to your appointments. That's probably the most important thing. Whether you're feeling well or not well, we want you to show up to your appointments. And we want you to know your diagnosis. You need to know your medications. You also need to know what kind of coverage you have for medications. And sometimes we don't always know that, but looking into that would be helpful. And then any other concerns you have that might be impacting you because of your arthritis. And then if you ever need to change your appointment, it's really important to let the clinic know so we can rebook you. We don't want you showing up, you know, a year later with a flare because you haven't been taking your medication or you didn't realize you had an appointment. So it's really important that you show up. Next slide. And from the parent side, you know, Dr. Rozenblyum said this perfectly, you know, it's about learning how to let your child become a young adult and take responsibility for their own care. And it's shifting from being the manager of their care to being really more supportive. Next slide. And for our clinic and for a lot of clinics, I think across the country, like I said, there are really 2 points of contact. You can go the old school way, pick up the phone and leave a message at the clinic. That's still completely appropriate to do. But more and more, particularly with COVID, lots of people are getting online and using patient portals. Our portal at Women's College Hospital is My Health Record. And a lot of people are now using that mechanism to send us messages. And I kind of like that way because you can kind of say in your own words what the issue is and what you need. And really you use this to ask about change your appointments or ask about any details about your appointment, to ask questions about any diagnostic tests that might be coming up or that need to be booked. And like I said before, if you're having a flare or any issues around your arthritis, that's really your point of contact. Next slide. And just to summarize, so our clinic was actually developed a year ago, and it's one of 6 transition clinics in Canada, and hopefully more as the next couple of years go on. Like Evelyn said, we really do take a team-based approach. So at the beginning and end of every clinic, we review all the patients and the plan and make sure we are all on board and in agreement with that. All new patients for the first time are seen by all of us. And follow-up visits, you may not always see all of us. You might see one of us or 2 of us, or maybe all 3 of us. But we always review every patient in clinic. And like Dr. Spiegel said, this is a process, not an event. So, and that's why we kind of follow people for several years to make sure they're ready to kind of move on into adulthood. And I think that was the last. And then really, we just want to provide you with a positive and supportive environment where you feel comfortable, you feel like you can ask questions. and learn about your disease and really reach your full potential.
Amazing. Thank you so much, Evelyn, Natasha, and Danielle. We are really excited now for usually the best part of these webinars, which is really the chance to ask questions. And we have so many good questions coming in. I'm really excited to ask them all. So at this point, I'll just ask Morgan, Lynn, Evelyn, Danielle, and Natasha all to turn your videos back on and your mics back on. And it'll be like a party. So we'll all get back on the screen here. And as we go through the questions, I'll probably just direct them to who might be able to answer them best. And also maybe sometimes we'll want to get a couple perspectives. So I hope Lynn has her video and mic back on, because I think the first question is best for you, Lynn. And I think it's a great question to start with, because it just is like the baseline question. It's like, just like, let's get this back straight. And the question is, do I have to move services? I'm happy with my care now.
It's a great question. Yes, in a word, yes, you do. You know, it's just like, we always sort of equate it to going to high school, right? I mean, you start in wherever you live, whether it's grade 8 or grade 9, or and you know, the expectation is you do want to move on. You want to gain skills so that it's going to prepare you for when you go on, like you move on to the adult side. And you know, in high school, the idea is you're going to graduate to either college or university or a vocation, but you are going to move on. And you know, it's important for you as well to continue to develop those skills. Practically speaking, you know, when we look at how the healthcare systems are set up, you know, there is funding on the pediatric side, and then there is funding on the adult side. And depending on where you live geographically, your government will have rules for when you really do need to move over to adult care. So it is necessary that you move on to access adult services, but that's a positive thing. It's a good thing for you.
Well, that's the perfect way to introduce Trish. So Trish is Morgan's mom. And Trish, when you realized that there was no way you could stay at SickKids forever, how did you feel? I guess the question's really like, what were your biggest concerns with Morgan's move? Like from the parent perspective, I think we heard some of Morgan's concerns, but how about you as a parent? Like, how did you deal with that?
I think it was mostly, I tried to pick up some of Morgan's concerns and ask her to sort of think a little bit about them. Morgan is such a friendly, warm person, and her doctors, she managed to have doctors throughout her whole life who reflected back that warmth and friendliness. And I think she developed a real attachment to them. She loved, it's not like doctor's appointments where it had any negative connotations for her because of how she was treated by every single person at every specialist clinic and even our regular pediatrician. And so my only concern was, oh my gosh, how's Morgan going to be at if the doctor doesn't have that same, you know, amazing bedside manner, I suppose is the term. But fortunately, SickKids followed us, right? Because the clinic is there and Dr. Gakhal was amazing. I was there just to support Morgan in the background for her first appointment. And I could see she was in excellent hands and was going to have no trouble whatsoever. It also helped that I have arthritis myself. I've been seeing a rheumatologist since I was 25. And I know that all of the specialists that I've seen have also shown that level of care. I guess you just don't go into this profession unless you genuinely care about helping people. And so I've had that experience. We also just tried to really empower Morgan from the very beginning. As soon as we learned that she had this condition and started to inform ourselves about it, involved her in that education process. You know, she was 8, so there's only so much you can understand. And as she grew, her understanding grew as well. But we started to participate in the information clinics that SickKids would offer. The process that was, you know, from the child's perspective of asking her to be able to identify what symptoms was she experiencing, making decisions and judgments about the severity of them. So we would go through the questionnaire. She would be the one filling it out. Did you get your health card before we got in the car? So just little things like that from the very beginning. And then I would say, maybe you were probably 16 or so. I always went to the appointments at SickKids. I have much more flexibility in my work than my husband does. So typically I was the one there at SickKids. And but even for other medical appointments, Morgan would go after school. She would be the one scheduling the appointment. She would be the one taking the TTC to get to see her pediatrician for minor concerns. So to be the one really taking charge of your health was very real in our family. In fact, I remember Morgan mentioning once to her friend, oh, I can't meet up with you after school. I have to go straight to the TTC and I have to go to my doctor. And her friend was like, your mom's not driving you? And she's like, no, I'm just gonna go. Well, is she meeting you there? There was this like, what is this rebel child who's taking care of doing her own appointments? And I just thought, well, I mean, independence has always been something we have valued. We've always played a supporting role, but as Morgan grew into it, then it was a great opportunity for her to feel like she was the one taking charge of this. So I don't know if that helps answer your question.
Absolutely. And maybe I think it's a great kind of segue maybe to Evelyn. So Evelyn, clearly Trish is not the mom just out of the Zoom screen during COVID, but it's a lot harder to hide in non-pandemic times. And so are there rules around whether the parents can attend the JIA Transition Clinic? Is it just the first time and then they're asked not to come? Like what's the deal with the parents who maybe are a little less, still feeling a little bit of anxiety about the handover?
Thank you so much for that question. That's great. And thank you, Trish, for your story and sort of setting the tone for that. So essentially, it's a work in progress with the patient themselves. So for the first visit, it's not about, I would say when we were doing in-person visits just before the pandemic, probably about half the time the patient would bring their parent. And I mean, it's not uncommon in the adult world also to bring, a child with you or a support person with you as well. So, we really let the patient guide us with that. So we always have time alone with the patient at every visit. And we also ask the patient, one of our first questions is, who can we discuss your care with? Can we discuss it with a parent? Do you want us to discuss with both, with one, with none? And that's sort of our guiding tenet. And then after that, it just really depends. We do encourage the patients to attend some appointments alone, but also we have had it where parents do come a bit more often, and it's a gradual. Also, since it is a new environment and new doctors, it's very common for the parent to feel a bit of that anxiety and unrest around, where is my child going? What is happening? But the hope is once they meet us a few times, they can feel comfortable as well and disconnect with with the patient, the young adult. And Dr. Gakhal, do you have anything to add?
No, I think I would agree with that. I think definitely in the first visit, a lot of people do come with their parent. And then as the visits go on, they tend to come by themselves. And you're absolutely right. I do a large adult clinic, and there's a large proportion of people that come with either their own parents. So you can, even if you're a grown adult, you sometimes bring your own parent or a partner or a friend just for support. So it's not uncommon even in the adult rheumatology world.
Another question we had is just, when you're asking your questions, whether through the Q&A or social, I encourage you to share a little bit about your story too, so that we can all learn from each other. But one parent just shared that her child or teen is usually like kind of standard, fine in appointments, a little bit quiet, not so forthcoming. So in that sort of situation, she's asking, how can I be sure that one, he's going to share the information he needs to share and get the care he needs to get?
So I can try to answer that. So You know, one of the things that we have found really interesting is often if the parent is in the room, it just becomes a natural dynamic for the teen to become more quiet and passive because they're so used to allowing their parent to play that role where they sort of, you know, present all of the information. And when we have the teen alone in the room and we're speaking directly to them, often there's a lot more, you know, they're much less passive and they're much more interactive. But then that gets to the next question. And of course, it's the huge concern that the parent is going to have. You know, I know my child and I know, first of all, either I don't think my child has enough insight to know what's going on, or they may, you know, if there's things that are upsetting them or bothering them, they may not feel comfortable sharing it with the team, or they may miss important things. And how can I be sure that that's going to happen? And so, you know, I think one way around that is really encouraging the team to spend time alone with the team, but then the parent has time afterwards, so that at the end of the visit, or whether they want to start off the visit or end off the visit, they can say, look, I'm not sure, but I just want to make sure that these were some of the things that came up. So at least it's a nice hybrid of you know, of encouraging the teen to be more autonomous, but also the parent is not feeling that they have to give up complete control until they feel that it's safe to do.
Yeah, well, maybe we'll actually just stick with you, Lynn, for a second, because I think that fits in well to the next question, which is like, who is responsible to, when maybe it's not question responsible, but who should bring transition up in the beginning? Like, is it the doctor who will start saying, you know, the child should maybe be here for their own, or is that the parent's job to start saying, we'd like to take more independence?
I'll talk about the way we were trying to do it at SickKids before the pandemic. But really, one of the things that we were trying to do, the idea is it's sort of graduated responsibility, right? And I always, again, equate it to high school. And, you know, students are sort of given more support in the earlier years. And as they are getting to the later years and prior to graduation, they're encouraged to sort of have more responsibility. And it's the same thing in our clinic. So, you know, we have had it set up where we started around age 13. And what we did was we said, you know, patients between the ages, and we actually had a written note that we gave to families at the beginning of clinic. And we said, you know, from ages 13 to 15, we are going to encourage your child to spend time alone with the team for at least part of the visit. And then the parent can come in and join them for the rest. And around age 15 to 17, you know, we said, you know, for most of the visit, your child is going to spend time alone with the team, and then you can join us at the end. And, you know, around age 17, I'm just sort of throwing out the numbers arbitrarily. We actually had the breakdowns properly, but around age 17, we really are going to encourage you to spend the entire visit with the healthcare team. And then, you know, if you like, your parent can join you at the end of the visit. So we kind of put those parameters there to sort of create that expectation. Some families were really comfortable with it. Other families felt, you know, I feel like I need more time. And of course, we've got to, you know, be adaptable and recognize both the parents' concerns and the teens' concerns, but that was kind of the framework that we used.
I think, you know, obviously right now, given sort of that it's fall time and a lot of people are just starting to apply to schools, or thinking ahead to not just the transition of care, but the transition from potentially high school to post-secondary education. We're getting a ton of questions coming in about that. And I guess like priorly, it might have happened more at the pediatric side, but Evelyn and Natasha, I'd be interested from sort of your perspective too, given that some youth might be delaying their entry to university, what kind of like support you can offer, or what kind of questions come up about people who are sort of entering university, and what kind of supports they should be accessing at the post-secondary level.
Yeah, I could start. That's a phenomenal question as well. Thank you. So we always ask, like I said, too, one of our main goals is that because the young adult is transitioning in so many areas of their lives, so not only their healthcare providers, but their schools or jobs or what have you. And it's about probably, yeah, I'd say like the new patients that we're meeting, some have started virtually like Morgan and are sort of carrying on with school, and then others have delayed and taken a gap year. And so with them, the ones who are in school, we do ask them for sure, are you associated with the accommodations office? And this week alone, Natasha and I filled out three forms for patients to get accommodations at school in case they do have a flare, so that they can access longer test times, and just any accommodations that are fit for them. And then in terms of for jobs, so we're also amongst all this, and we're happy to share this with the group here at large. We're also trying to create a binder of resources where we'll have all the school accommodations, what to ask and look for in school, but then also work accommodations and WSIB and all of those other forms.
Even more specifically, so someone shared that they currently live in BC, but they will be going to the University of Toronto, which is so exciting. And so they're asking, can you access the JIA Transition Clinic program if you're coming from BC?
Mm-hmm. Natasha, is it okay if I continue, or? Yeah. Okay. So basically from that perspective, like I mentioned, in the Canadian Rheumatology Association, a lot of the rheumatologists who are involved in transition are getting together to sort of create a master list of clinics that deal with this patient population, because it's very common that if you live, thank God, you live in BC, you can learn in Toronto, Montreal, Ottawa, wherever. And so we do want the care to continue. By and large, we find that when patients are flaring, they often like to be home and take the time to be home. But obviously that's a huge trek, and with COVID and everything, regardless, that's a long-winded way to say we're happy to help and assist with care while the patients are in Toronto, and have a shared care model that way. To be included into our clinic, you just have to have a diagnosis of JIA and have been followed by a pediatric rheumatologist, and then we're happy to see you.
And so would they have their pediatric rheumatologist refer them to your program, or could they just contact directly?
So it would be better to have a referral in that way. But again, at least in the pediatric side, I think also in the adult side, they're quite close. But in the pediatric side, there's not as many of us. So we're very friendly, and we know each other very intimately from previously from training and conferences and everything. So it's really easy for us to connect as well and actually, we even got a referral from Qatar from an old classmate of mine who I trained with at SickKids, who's originally a Canadian from BC and going to school in U of T. And so because of that, it's very, but even from Qatar, we were able to facilitate the transfer. So the world is small.
Amazing. And I know as well that the clinic at BC Children's, their yard program also takes referrals from outside of the province if students are traveling to come to school in BC. So that's so great that people can access support wherever they're coming from, if there is an established clinic in place. And of course, not all students stay in the cozy confines of Canada either, though I know many parents would like them too. But have you had any experience or any tips for a youth that's transitioning to say like a travel or study abroad program outside of Canada?
Mm-hmm. Natasha, did you want to mention that patient who we have? I think they're
we actually have a few patients of ours that are in UK and the United States. And what we do is pre-COVID, we would just organize visits when they were home, right? So we would say, when are you coming home? And we can typically slot them in. So people typically come home at Christmas and then at some point in the summer. When you are out of jurisdiction, I mean, obviously medications and blood work you do need to have somebody there, but we still keep them linked to the clinic, and they still do come in, you know, a couple of times a year when they're home, just to check in and make sure that the plan doesn't need to be changed. So that's not a restriction for us, but we do have a few patients who are actually studying abroad. But you know, you guys all come home, so it's not actually that hard to see you a couple of times a year, just to check in.
Oh, that's right. Yeah, because we have the patient in Scotland as well, and the US. I did want to mention as well, a lot of the pediatric rheumatologists and ACPACs are part of a pediatric listserv that services North America and around the world. So it's not uncommon for someone to say, hey, I have a patient who's going to, you know, somewhere in Oklahoma, and they need an adult rheumatologist. Who can I refer them to? And so, and often, or China or wherever. I mean, obviously now it's probably less, but it's very connected that way.
Yeah, that's exactly right. I was gonna mention exactly what Ev mentioned, and it's really not uncommon for us when our patients say, "I'm going to such and such a place." We're actually a fairly small community. We all meet each other at conferences. We know each other. There's a lot of collaborative research that goes on, both nationally and internationally. So it's easy for us to pick up the phone if we know somebody's away, or ask her colleagues, do you know of somebody, so that we can connect you if you can't get back home.
Awesome. I think this next question, I think Morgan, you might want to give it a shot. It's definitely a youth looking for sort of advice, and maybe this wasn't your case, but just sort of put yourself in the shoes if the situation happened. And the question is just like how can I build sort of like this new relationship, and hopefully a great relationship, with my new transition clinic team? And what like advice or thoughts might you have? Like, what if we're not getting along? And I maybe even Natasha or Deb or Danielle could jump in from that side. But just that, like, what was it like to just build a new relationship?
Yeah, I only transitioned in May, so I still feel like these doctors are still very new. I've only had 2 appointments, or maybe 3, but I would say you're not really, you know, you don't have to go with that doctor if it doesn't work out. I think there are many rheumatologists, and I think hopefully they would agree that, you know, if you don't feel like the care is working out for you, or your personalities aren't, I know that sounds bad, but I know this is not like personality based, but if you aren't feeling comfortable with your doctor, I think there are plenty of other amazing doctors that you definitely go to. And I don't think you are trapped kind of to this clinic. You know, this is a great opportunity, but of course, if it doesn't work out, I think doctors would agree. They just want you to get the best care possible and where you feel comfortable. I would say what I found the best for me in trying to meet my doctors was just like sharing a little bit more about kind of like my life, more than just about my joints. So sharing about, you know, like who I was as a person and what my hobbies and like interests were. So I felt like I could connect on a little bit more of like a personal level. And that's what really helped me. Maybe that would be able to help you. I think the doctors might be able to do a better job at answering that one.
That was so great. And I know you mentioned that you are super active, and so like sharing your goals, like if you have goals around physical activity or work or certain you know, whatever it is that you want to achieve, then kind of working together to share those with your team so that you can be a team. Yes. Natasha and Evelyn and Danielle, do you have any experiences or advice if things aren't going well?
Yeah, if I may say something, I think communication is a key when we're dealing with a chronic disease, and especially in a time of change. I think I do a lot of education with adults in rheumatology, and we talk a lot about psychosocial impacts of having the disease and having to self-manage this thing. And we find that communication with your doctors, it's not just communicating with your family or your work or your, you know, at school. It's really communicating with your doctors and making sure they hear you. They might hear you and they're asking the next question about your blood again, but you just have to learn to communicate really effectively so that they understand. I think it's a key thing, communication. It's a great opportunity to develop that skill.
Yeah, for
I
sure.
just wanted to add something as well. What some of us on the pediatric side will do is when we are arranging for our patients to meet the adult provider, we will schedule one more appointment after that initial visit, even if they've already turned 18. And one of the reasons for that is it's not always going to be the right fit, and that's just the reality. And, you know, our worry is if it just doesn't go well, they won't, you know, our patient won't make the next appointment. Fall through the cracks. And, you know, come back to your team. If for whatever reason it doesn't feel right to you, let us know on the pediatric side so that we can make alternate arrangements for you.
Mm-hmm.
Absolutely. Thank you, Lynn. And we often have that where they say, oh, I'm going back to my pediatric provider. And it's such a nice knowledge to know that, you know, in case it wasn't a good fit, they're at least taken care of. And, you know, sometimes a patient doesn't like the shared care model that we provide. Sometimes geographically, it's just not convenient for them. And that's fine. And if they decide that after they've really finished with their pediatric provider, let's say a year later, then, you know, Dr. Gakhal can refer to any one of her colleagues or Danielle who knows someone in the community. And then we just follow them until they are successfully and properly transferred, making sure that there's no lapses in medication and all of that. So, you know, there's no egos, there's no hard feelings, just sticking with the transition principles.
I think, Lynn, maybe this is a great question for you, and it kind of goes to the best principles of transition, but there's a parent who's kind of sharing that their pediatric rheumatologist is leaving, so let's just say retiring for sake of filling in that gap. But so she's wondering if her daughter should transition to adult care, who's currently 16, or should she just stay to see the pediatric rheumatologist who's filling in. So sort of that like closing off of a relationship. Should we just transition anyway, or is 16 too young?
So, you know, again, it comes back to what I was saying earlier. It depends. Well, there's a couple of things that depends on. First of all, it depends on where you live and whether the adult provider can even start seeing a 16-year-old. The second thing is it's transition readiness. And I would say between the ages of 16 and 18, you know, Evelyn sort of talked about it a little bit in her talk. There are things that pediatric rheumatologists have a lot of expertise with, not just in terms of rheumatology, but just in terms of some of the developmental issues that teens are dealing with. It's a very important time in life in terms of, you know, coping with school, relationships, stress management, you know, a lot of different things. Many people wouldn't feel ready at the age of 16 to transition. It really depends on the individual. Some people really are very ready. So it's not a one size fits all. But, you know, I would say that if there's 2 years left, and at least meet the pediatric rheumatologist and see if it's somebody you feel comfortable with, because those 2 years could be very important in terms of developing some of the transition skills you need to be successful on the adult side.
And I think maybe the JIA Transition Clinic team can probably speak to this one, but if parents just asking about, you know, what you've observed or noticed in terms any differences between females and males in the transition process.
Sorry, who was that question for?
Maybe we should have a panel. Boys versus girls. Everyone can weigh in, but I mean, what about Natasha? Like, Natasha, have you, like, as the adult rheumatologist who's receiving these teens, have you noticed any differences? I don't know if the question didn't specify readiness or anything, communication style, etc. But, and I know obviously it's a generalization anytime you talk about gender differences, but any insights on that question?
So that's a great question. And actually, to be honest, I don't think I ever thought about it before. and I'm probably going to reach out to Evelyn to see if she noticed any differences. I feel like maybe males might be slightly more quieter in the room when we're there. But other than that, I'm not sure huge differences otherwise stand out to me. Evelyn, what do you think?
Yeah, again, I think, I mean, very generalization, like, when you're going through your adolescent period, males sometimes sort of go into like a more, less speaking, more Neanderthalish, like one word answers, whereas females sort of start developing, more of that attitude and whatever. That's, again, the stereotypical sort of transitioning in that. Obviously, there's overlap and it really depends on the patient. We do have a really nice mix of male and female. Generally speaking, JIA affects more females depending on the subtype. But actually, we do have a lot of male patients, which is really nice. And in practice, I really find that there's a big variation. Again, like Dr. Gakhal, so we haven't really thought about it because actually the stereotypes I don't think hold as well in the adult population. So sometimes we will get a quieter male, sometimes we get a quiet female. And, sometimes, it also depends on the family dynamic and the parents. So actually, I agree. I don't really have many specific suggestions in that, but we will reflect on that for the next talk. I think that's interesting.
I just wanted to add to that. When we did our peer mentoring program, it was really interesting. When we were trying to recruit males and females, and then we sort of try to analyze our data afterwards, there were some differences we did see, and there were lessons learned for us. So, when we were trying to match our teens with adult mentors, we found that our females really enjoyed the process and they had these lengthy conversations and they really explored different issues. And a lot of the males did not love that format. They really didn't feel that it was necessarily supportive to link and have these long in-depth conversations. And when we're studying it in patients with hemophilia as well, because a lot of those patients are males. And we were trying to see what was more appealing. And often it was sort of, getting involved in an activity with somebody their age. And through the course of doing that activity together, maybe at that point things could come up and they could sort of share experiences. But it was interesting for us to find that there really was a difference in terms of what teens felt was helpful when they were accessing supports.
So interesting. Thank you for bringing that up, Lynn. And actually comes to mind a conversation I recently had with a male patient. He's like, so like, what's the big deal with this whole transition thing? Like, I just came and that's it. And now I'm transitioned and we're moving on and done. And like I spoke with their father, it was like also like, okay, like I appreciate the whole clinic thing, but like, what's the big deal? And so like when we really get into it, they're like, oh yeah, no, I really see the value and what it is all about. And to be honest, we do thankfully also at Women's have access to mental health services. And like, there's a lot of anxiety, depression in this generation, generally speaking as well. And so like, we do sort of almost equally refer our patients to, healthcare, mental health services as well for extra support. So not much difference in that, but it is interesting to see how it all evolves.
Amazing. We have about 4 minutes left for the Q&A. And so I just wanted to let anyone know, we've had a couple questions specifically about how to access iPeer-to-peer. Is it available at different hospitals? So we're going to follow up with that by email after the session, because I think those are great programs, and we definitely want to let people know. We'll send out the link to Teens Taking Charge, let you know about iPeer-to-peer if there's opportunities to be involved. I know there's another study for teens called I Can Cope, which is a health app that can help them as well. So just know that all that information will come by email to everyone who attended tonight. I think one of our sort of last questions we might end on, and I think it was in Natasha's part of the presentation where it said, come prepared with your health insurance information. And the question is actually, and I know that this you might only be able to answer for Ontario because it varies province by province. But the question was like, what changes when youth transition to adulthood in terms of the drugs and the associated costs? So like, for instance, with something like biologics, will they need private insurance or will they still be covered under provincial formularies? And of course, if you can only answer for Ontario, that's totally reasonable.
Yeah, I think it will have to be Ontario specific. That's a great question. And in all fairness, there's once again lots of adults who have no idea about what their insurance covers. And you don't really know until you need to access it and look for it. The big change that happens probably from pediatric to adult care is that, you know, a lot of kids aren't covered under their parents anymore. If their parents have a plan, they might be covered under OHIP plus. Typically, if you had a biologic as in pediatric, we can continue that coverage through to adulthood. We haven't been able to, we've been able to keep everybody going. So that isn't as much of a concern. I'm never typically concerned about, oh, how do I keep this 19-year-old's coverage going? So in that sense, I don't typically worry about that. It's typically around like, oh, I'm only going to be covered under my parents' plan for so much longer, and then I'm not sure what I'm going to do, and they don't really know about the provincial plan, and we don't really know what the provincial plan is going to cover. Those are the issues we come up with. But if you were covered for a biologic as a child, we can typically continue it on.
Amazing. And we, you know, at Cassie and Friends, we can work with our medical advisory committee to try and fill in some of that information or just help direct people where they're going. But Natasha, I think the perfect last question is for you. We didn't want to leave pediatric care, but we did, and we did it, and we had a great time in our transition clinic, and we feel so good now. And now I'm 25. Can I stay with you?
Yeah. So we haven't gotten there yet, but I'm sure we will in the next few years. Yeah, I mean, you know, our clinic overall is in a large volume clinic. So, you know, I kind of thought about that, you know, after people turn 25. And I think that would be totally fine if they want to continue on care. The reality is, though, is you guys will probably move away, right? So a lot of, and I see a lot of people in their early 20s who don't have JIA but developed arthritis when they were in their early 20s, and they move away for work, school, relationships. So even though I would say keep an open mind that when you come in at 17, 18, and you're kind of crossing your fingers going, oh my God, I hope I can stay on after 25. The reality is you might pick up and move across the world, right? So, but yeah, because the clinic isn't a large volume clinic, and typically you'll be able to stay on if you want to.
Amazing. Well, Morgan, we look forward to following your journey through transition, and we hope just all of the best for you. And thank you so much, Morgan and Trish, for being a part of this session. Lynn, Spiegel, thank you so much for bringing the perspective from the pediatric rheumatology side and all the amazing care that you provide, you know, patients sometimes right from toddler to adulthood. And I know that transition can be hard on the caregivers as well. And to the team who's helping the youth make that passage from pediatric to adult care, and all the wonderful, amazing things they're going to do with their lives. Natasha, Evelyn, and Danielle, thank you so much for making that a little bit easier, and just providing such excellent care as well. So thank you so much for being a part of our session tonight. If anyone else has some questions, please just email info@cassieandfriends.ca, and we'll do our best to answer those by emails after the session. We just have a few closing words here. One is that we learned so much tonight, and would love if you would share your insights or feedback. You can do that now at any of our social media channels. You can see Twitter, Facebook, and Instagram here. And also just please follow us so that you can find out about upcoming sessions. Next slide. So upcoming sessions, well, right after this survey, again, providing feedback is so important. Let us know what you liked, what you didn't, what other sessions you would like to hear. So you're going to receive a survey by email right after this event, and we really, really hope everyone will take the time to fill that out. Our next session is led by a registered psychologist from BC Children's Hospital. Her name is Dr. Penny Snedden, and she'll be talking about anxiety and depression in children and teens with rheumatic disease. So not only will she talking about some of the therapies and approaches, but also just the way that a rheumatic disease, chronic pain, even things like needle phobia, what kind of impacts they can have on mental health. And I think, moving into the new year, that's such a timely topic. Especially during this time of increased anxiety and social isolation. We're also planning a ton more sessions for 2021, so stay tuned. And again, there's really no better way to support yourself in your journey than by building a network and a community of other parents who can truly understand what you're going through. And so you can find that on our support network, which is at cassieandfriends.ca/support network. We also have some really handy tools there, like a medication tracker, different like activity and fatigue and pain trackers that you can then use to kind of track that in between time, so you can bring to your appointments this sort of record of what's been going on. Next slide, just a final thank you so much to our series sponsors. We're just so thrilled to be able to bring this kind of information to our community of youth, parents, and healthcare professionals. So thank you to Nicola Wealth, AbbVie, Amgen, Roche, and Sobi for your contributions. Lastly, please do keep in touch. Cassie and Friends is truly run by patients, parents, and healthcare working together. So if there is something that you desire to see in this community, if you have a way to get involved, if you appreciated the session and are moved to donate, Cassie and Friends can use your support in any of those ways. And please, if you have any questions, again, just email us at info@cassieandfriends.ca, and we'll be very pleased to answer them. So thank you very much to everyone from coast to coast who joined us tonight, and I hope you have an excellent evening. Thank you so much.